Hello, I'm Dr. Ali Enver. I have been working as the responsible physician at Vita Altera IVF Center in Cyprus for 6.5 years. In order to achieve pregnancy through IVF treatments, we basically need 3 essential elements: an egg, sperm, and a uterus. If any one of these is missing, achieving pregnancy is not possible. For this reason, in certain groups of patients, we may have difficulty finding good quality eggs or any eggs at all. These patients may include women over the age of 38 or 40, younger women with diminished ovarian reserve, or women who have lost their ovaries due to surgical reasons. In such cases, it is possible to achieve pregnancy through egg donation in northern Cyprus. When a couple comes to our center, a donor profile is selected based on blood group, ethnic background, and physical characteristics, and this profile is presented to the patient. Once the patient approves the donor's eggs are fertilized with the husband's sperm using the microinjection (ICSI) method, and the resulting embryos are transferred into the woman's uterus to achieve pregnancy. This procedure is known as egg donation. One of the most common questions couples ask is how egg donors are selected. In northern Cyprus, this process is regulated by certain legal requirements. These include criteria such as the donor's age and mandatory medical tests. Among these tests, a chromosomal analysis is required for every donor. All donors are also screened for sexually transmitted diseases. In addition, based on ethnic background, donors are screened for conditions such as thalassemia or sickle cell anemia. Beyond these legal requirements, we also perform carrier screening tests on donors at our clinic. These tests are particularly important to reduce the risk of genetic diseases such as SMA, which are relatively common in our region. After all evaluations are completed, the donor is selected together with the patient. The procedure generally progresses as follows. First, the male partner comes to the center and provides a sperm sample. In order to provide this sample, serological tests, including hepatitis B, hepatitis C, HIV, and syphilis, must be completed in advance. The sperm sample is then frozen and stored. On the day the selected donor's eggs are retrieved, the sperm is thawed and embryos are created using the microinjection technique. If the patient has a previously known genetic disorder, the embryos can be genetically screened. In cases involving high-risk or dominant genetic diseases, additional carrier testing can also be performed on the embryos. The embryos are then prepared and frozen. Once all embryos are confirmed to be healthy, the couple is informed about the number, quality, and health status of their embryos. After this, the couple is prepared for the embryo transfer stage. Preparation of the woman's uterus begins on the 2nd day of the menstrual cycle and typically takes about 19 to 20 days. This process involves oral medications, injections, and vaginal suppositories. The uterus is prepared to be receptive to pregnancy, and synchronization is achieved between the embryo's developmental stage and the uterine environment. For example, 5-day-old embryos are transferred into a uterus that has received progesterone for 5 days. This preparation process can be carried out in the couple's home country under our supervision and in coordination with local physicians. We remotely guide the medication protocol and monitor ultrasound examinations and blood tests. Once everything is ready, the couple travels to Cyprus, either on the morning of the transfer or 1 day earlier if they are coming from a distant location. The embryo transfer is performed around midday. The couple stays at our center for 1 night and returns to their home country the following day.